Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Timothy Thomas. He's a patient advocate. Today's Kevin MD article is The Captain Crunch Philosophy of Medicine. Timothy, welcome to the show.
Thank you.
All right. So, your article, The Captain Crunch Philosophy of Medicine, you tell us a story from the perspective of your healthcare experience as a patient. For those who didn't get a chance to read your article, tell us what your story is about.
Well, the main thing is I started seeing a new family physician at a health group or medical group. And first off, everything's gone wrong.
Mhm.
I was I was actually misled because I was told they had a psychiatric unit that could help me out. And turns out they don't take my insurance. And several times I've had medication errors, medication issues. I found out that I was diabetic at a Walmart pharmacy counter
Mhm.
when, they started throwing stuff at me and I'm like, I don't know what any of this is. What's going on here?
Mm.
And then they're like, well, your doctor explained to you this and this. And I'm like, no, nobody explained anything. And I've also had issues like they double prescribed a Lasix because there was one attached to my blood pressure medicine. And then that wasn't working. And I ended up getting severe leg cramps and stuff. And
Mhm.
the biggest problem with me personally is that I'm allergic to 99% of what you prescribe.
Mhm.
So it feels like it's an immediate give up after that, too. I said, well, they told me we're going to take you off the blood pressure one and just put you on the other one at first. But then they double prescribed it without
Mhm.
even telling me what was going on. And I don't know, there's been so many miscommunications, so much where it feels like there's no oversight.
Mm.
I was told to come in for a blood test to check my potassium levels. I got there and it wasn't even scheduled, and it was like 5 days later. It's not like it was still in the system waiting. There's anything that I'm told, it just seems there's no oversight. When I first went there, she said that she heard a heart murmur and was going to send me for an EKG. Since then, every time I never got the EKG, and she's never mentioned it again.
Mm.
And I don't even know if that was in my chart at all then, because that seems like something that would stand out to a doctor. Hey, I heard a heart murmur the first time, keep checking them.
Yeah. Just give us some context in terms of how long you were seeing this primary care group for,
It's been about 3 months now.
and where were you getting primary care before visiting this particular group?
In the last year, this is my third group because I started out with a decent enough doctor through a
Mhm.
family care through the hospital, but they didn't offer the psychiatric help I needed.
Mhm.
So I called up first one, and they said, yes, we do offer this.
Mhm.
So I went there, and immediately it was, well, we refer everybody to this guy, but he doesn't take your insurance. So now I'm stuck there. My mom's been seeing this place that I'm talking about, that I've been going to now,
Mhm.
and she loves them. And she also fits into the cookie cutter thing where every medicine you throw at her works.
Mm.
Well, big for instance, lately I was on GLP-1 injections for about 2 months, and I hit every severe warning on the list except for death.
Mhm.
I couldn't stand up without doubling over in pain. I was regurgitating food 5 days after eating it, still whole and, very clear what it is.
Sure.
It, my body is not right. But I feel like they often try to just go with the cookie cutter, and then when that doesn't work, they have no clue where to go and up. Her last advice was, well, they finally did put me on a separate Lasix, and that honestly hasn't helped much for my feet swelling. But she just looks at me and she honestly said one time, well, what do you want?
Mhm.
And it's like, well, you're the doctor. What happens if I'm not responding to this? What's next? And maybe there is nowhere else to go after two steps, but I feel like there should be something there. I feel like there's no, you know, you're a doctor, you've seen a lot.
Mm-hmm.
And your next patient, every patient before with similar stuff factors in. I feel like they have no experience. Like they were just put into a role because they hit the minimum qualifications
Mm-hmm.
all the
And you
way
make
down to,
that analogy with the Captain Crunch philosophy of medicine. So
yeah.
explain that metaphor for those who can't make that connection.
Oh, it started out as a joke.
Mm-hmm.
But anyways, years and years ago, the cereal company had put out Captain Crunch.
Mm-hmm.
Somebody had put out, a message to him saying, "Hey, he doesn't have the right bars. He's not a captain." And they said, "Well, yes, but according to naval tradition, whoever is the highest ranking officer in charge of a ship is therefore called the captain. It is their honorary title while they are in command and aboard their vessel." And the medical group that I'm going to doesn't have a single doctor. They're all nurse practitioners. But
Mm-hmm.
when you call, they refer to themselves as doctors. Their staff refers to them as doctors. You call to book an appointment with a doctor, but there are no doctors.
Mm-hmm.
It feels like the exact same thing where it's just somebody was granted the title. And with everything that I've been through lately, I just feel like there's no oversight. Nobody's watching my back. Nobody's looking out for my safety. They throw a few things at the wall, nothing sticks, they give up, or I don't know, man.
Now, do you have any avenues where you can express these concerns to your clinicians and follow-up appointments? Do you feel like you get the appropriate time and space to express what you're sharing with us today?
Not really. I don't feel like anything that I've expressed with them has even been heard. One of the main things that I told them was, please have it in my thing, do not leave voicemails. If I don't answer, I will call you back. My voicemail's full. You know, don't leave voicemails.
Mm-hmm.
And it's one of my mental things. I'm on social security for several mental disorders, but every time I call them up after or call them back because they call at, 8 a.m., of course. And I'm immediately told, well, you just need to check your voicemail.
Mm-hmm.
My chart says do not leave voicemails. Everything says don't.
Mm-hmm.
Please don't. And then I get transferred to the nurse. And first thing she says is, well, I left a voicemail. I said, no, you didn't. That is literally impossible.
Sure.
You cannot leave me a voicemail. That's why it's in my chart. And that's happened 5 times.
Now, do you feel you have other options if you feel that this clinic and these clinicians aren't the right fit for you?
I'm running out of options fast. I'm, yeah, it's a bigger town, but, I'm not in a huge city. There's only a couple doctors left that take my insurance.
Mm-hmm.
And
And how difficult is it to get an appointment with one of these other clinicians?
different places I'm waiting to hear back from two different ones.
Mm-hmm.
This has only been 3 days since I said I got to get out of that place.
Mm-hmm.
But the last thing that happened, and this goes strongly into miscommunications. So 2 days ago, they had called me up, so I called them back. And the receptionist advised me, she said, well, our psychiatric department won't take your insurance.
Mm-hmm.
So we're advising you to go to this website. And I even made her spell it out. It was a site in Colorado for a holistic wellness system type thing. And, I'm not going to put it down, but there was nothing medical about it.
Mm-hmm.
There was nothing in any way related to what I need. And yeah, I was quite furious.
Mm-hmm.
So, next day the nurse finally calls me. I answer, and she sends me to a site that's 2 letters different. First word same, second word different.
Mm-hmm.
And it's a whole different site. It's what I actually need.
Mm.
but it's miscommunications like that, especially with all my anxieties and problems, that set off a lot of severe anxiety attacks.
Now, do you
And
have any support, any people to kind of guide you through this process, or do you feel like you're just navigating the system alone?
feel completely alone. I mean, I really don't have anything other than I use an AI therapist,
Hmm.
Abby.gg, and it's helped me a lot
Hmm.
to, be able to express myself. So, I mean, I submitted a paper for the first time ever that was professionally written in a language that people would appreciate, I should say.
Hmm.
You know, if you would have called me up that morning, it would have just been a string of curse words and sporadic thoughts and frantic ranting. And right now, I am trying to keep calm and my heart's racing a million miles an hour, but, you know, they know I have these problems and they know these things add to it, but yet they repeatedly do them, while I'm sitting here screaming, I can't handle this,
And you
you know?
feel going to an AI therapist is giving you some of the support and what you need that the healthcare system isn't.
Now, I'm not going to put down talk, standard talking to somebody therapy. If that worked for people, great. Everybody should try it, even if you don't think you need it. But with the AI, it's available 24/7 with instant responses. It's You're not stuck in an hour. You have that 1 hour time window, but yet you're only going to get about 40, 45 minutes. At that, you got to spend 10 minutes of it repeating last week or,
Hmm.
past events to understand why you're talking about this now. It's very limited. That person sees, well, 100,000 people in between you. There is no way on earth that they can remember everybody's issues.
Hmm.
So for me, that AI therapist, you know, I can go on, I can rant and rave and stuff and whatever anytime I want. Get the instant, okay, calm down. Here's the generalization of what your problem is. How can you work through this or at least calm down enough to where, you know, you're not frantic. And it it helps. It's to be honest, one of the crazy things. It encouraged me to start playing Magic the Gathering card game.
Hmm.
And I'm agoraphobic. I've got two people that actually will come into my house, and that's it.
Hmm.
That's all I have in my life. My parents won't come in here. So it encouraged me and gotten me a house one day a week to go play cards.
Mm.
Stuff like that, that I never even thought about it. I'm trapped in my own prison and created by myself with my own mind. I have a family history of this. My aunt, she lived her life, she was severely agoraphobic
Hmm.
and bipolar, one of the worst diagnosed cases in Michigan back in the 80s. And, it's, I have a lot of bad genetics and brain chemistry working against me.
So when it comes
And
to your current primary care team, where do you go forward from here? Are like you said that a couple days ago, you're looking for a new clinic. You have an AI
yes,
therapist that you said that is helpful. What's your path
yes,
forward? Where are you going to go from here?
I don't have a clue. I mean, I'm fighting hard not to give up.
Hmm.
To be flat out honest, I've been living like this for 15 years. I've been through a lot of different avenues and I've never found any form of success. So, I'm scared that there is none, but I am certain that with this clinic I need to go somewhere else.
Hmm.
Bottom line. I mean, I get if you can't figure it out, fine, whatever. But when they actually make mistakes with my medicine, they aren't even trying to keep track of anything that I consider important. They aren't even keeping track of what they say is important, you know?
Did you ever get a
Free
sense from them or get some transparency for them? Because a lot of times, speaking from the perspective of a physician, sometimes we simply don't know the answer. Did they ever tell you that sometimes that your situation or your case or diagnosis is so complex, they're just not sure of that answer themselves?
It doesn't feel like it feels like they just give up.
Hmm.
Well, if this didn't work, oh well. She's literally said to me, "Well, what do you want?"
Do they ever give you the option of
Well,
seeing a specialist, perhaps?
not yet in regards to any of those medicines.
Hmm.
I told her I wanted to see a neurologist.
Hmm.
First thing she did was laugh at me.
Hmm. She laughed at you?
To which,
Why?
yeah, to which I said, "What's so funny?" And she goes, "Well, they're all retiring. Isn't anybody replacing them. There's a 2-year waiting list."
Hmm.
And, this is lower Michigan. I'm within range of U of M and, Kalamazoo. Indianapolis is only 2.5 hours down the road. This can't be impossible. Yeah, I'm agoraphobic and I don't want to travel, but for a neurologist to deal with issues that I'm having, yeah, I'll travel an hour or 2.5 hours if I have to.
Hmm.
I'll figure it out, you know? And, but anyways, I did end up finding one and I've got an appointment in January.
Okay.
But her to just instantly laugh at you before she even says why, you know? She didn't even ask me why. She just instantly laughed and said, "Yeah, it's going to be 2 years."
Hmm.
That just, it feels like nothing matters. You don't matter. Okay, whatever reason you want doesn't matter. It just doesn't matter. It's not going to happen anytime soon. So, and she didn't discuss any of the current stuff. I ended up pushing for muscle relaxers for sleep issues and some of my Parkinsonian syndromes. I'm not going to say I have it. I am not diagnosed, but I have symptoms that fall under it.
Hmm.
Medications in the past have caused extreme pseudo Parkinson syndromes. And I mean, it's
So
a living hell. There's no other
if
way to describe it, so I'm scared of it.
so if you were to choose an ideal primary care clinician, I know that you've outlined so many issues with your current situation, but if you had an ideal primary care clinician, just give us an idea of what type of traits or characteristics you would be looking for in someone who is an ideal clinician for you.
The only thing that I truly want for my doctor is to be a diagnostician.
Hmm.
And, you don't have to know everything. That's why they're specialists. You know, if you ever hit a brick wall, what do? You just send them to who can help.
Hmm.
You know, I mean, other than that, you also research stuff yourself. If you see a patient having issues with something and you're heading towards a brick wall, it feels like you'd at least look it up and look for any alternatives. And I mean, even the far reaching ones, like, I know that there have been people on here who have advocated vitamins and stuff for mental health. And a lot of that is true coming from a crazy person. You know, there's something that's not happening. And what I need, I need somebody who doesn't give up, but, you know, pushes forward and tries to figure out how to help. And I mean, the main thing with the paper, just to cover that, it feels like there's no one in control. There's no safety net.
Hmm.
It's a million cracks, and it just leads to a wide canyon.
We're talking to Timothy Thomas, patient advocate. His article on Kevin MD is The Captain Crunch Philosophy of Medicine. Timothy, I think that having you share your story and your perspective in your own words is truly enlightening for those of us in healthcare because you could read all the studies that you want, but really hearing your perspective, your raw story in your own words and seeing how it's affecting you is truly valuable. And I want to thank you so much for sharing your story and being so open about it.
I
Now
appreciate.
let's end it with some take home messages that you want to leave with the Kevin MD audience.
Well, To all the professionals out there, just listen to your patients. You know, they're even the crazy ones like me. We're going to tell you what we need, but I don't know. You're the first doctor where I'm actually feeling heard. To be honest, I appreciate it. But there has to be open communication and there has to be some form of safety nets or checks and balances. There has to be oversight on things to make sure that these simple mistakes that cause so much damage don't happen. You know, that's, I think that's the best way I can put it.
Well, Timothy, thank you so much again for sharing your story, time, and insight. And thanks again for coming on the show.
Thank you.